po, Vice President po yan ng AMOP. Presidente siya ng Intellicare. Pinag-usapan po natin itang AMOP, itang Association of Health Insurances dito sa Pilipinas. Now, accredited, you mentioned accredited. How do you, before accreditation, how do you get companies to be under your umbrella?
All right. Basically, we know as a nation, in our constitution, kasi nandyan yan that it is the right of every Filipino to have health care.
Narinig po ninyo, It is the right of all Filipinos to have a health care. Yes. Tandaan po ninyo yan.
And given that in our constitution, the government has been trying its best to provide that. But as we all
through PhilHealth.
Through PhilHealth, through Philippine National Insurance.
National Insurance.
However, we know that the resources ng government, hindi naman tayo mayaman. So they try to make the best of it. And the private sector, kami yun, have been invited to help in bringing healthcare coverage to as wide a population base as we have. So we are helping the government in the attainment of this constitutional mandate.
Ito pong mga health insurance na ito, kamukha nung sa HMOs na yun, para sa mayayaman lang yan. Is it expensive to be a part of these HMOs?
In fact, the opposite is true because the HMOs cater to a membership base that includes not only the employers, the owners of company, but the employees, all the way to the rank and file, the way to the messenger, to the drivers, and in many instances, to their families. So the mass population that comes into the membership base of HMOs is truly a reflection of the nationwide population.
Ganda naman na po noon, Kamukha noon, isang kumpanya ninyo. Yung mga nagtatrabaho po ron, meron silang health insurance. Hindi lang sa kanila yon, pati yung mga members of the immediate families. Kanya, sana yung mga kumpanya natin dito sa Pampanga, dito sa Clark, dito sa Pilipinas, sana magkaroon sila ng health insurance para sa kanilang nagtatrabaho.
That's right.
Hindi ba?
That's right, Doc.
Now, talking about how. Now, are there many hospitals all over the Philippines that are accredited under your Intellicare?
Well, for Intellicare's case, we're very, very proud that in the past 13 years of our existence, we can claim without batting an eyelash that we have one of the biggest, if not the biggest, network in the whole country.
Siguro po kanina, kausap ko lang itong kaibigan ko si Edmond saka si Butch, yung kasama po natin dito sa Intellicare. Minsan po, pumupunta pa hanggang sa Basila, sa Tawi-Tawi. Sabi ko, meron bang membro ng Intellicare doon? Sabi naman nila yung mga bangko raw.
Yes.
Mga banks.
We have many of the major banks of the country with us. We have major food companies and major power distributors. All of their employees, all of their families are scattered nationwide. So it doesn't mean just because you covered a company that exists in Metro Manila, na nandun sila lahat. Kasi pwede naman nanggaling ito sa General Santos, yung tatay, nanay niya nandoon, o yung pamilya ng isa to baka nasa Basila naman. So when we say we cover the people, we cover wherever their reach will be.
Galing-galing. Ayan po yung Intellicare. Mamaya, pag-usapan natin nun As President, bakit naman napakagaling mo? Ano bang galing mo? Pag-usapan po natin yan. Ngayon, itong nationwide, what about your doctors? Are they comfortable with their monthly, anong tawag na lang? Monthly collection?
The beauty of this system was set up by Dr. Ricardo Hoxon. This is the medical director of our company. And it is to him and the team, the medical team, that formed the real skeleton of our network. Because we wanted to be sure that all the doctors that we affiliate are either fellows, diplomates. and in areas that none are available, that they could get the doctors in that area. Because they wanted from the very beginning that our organization should always be able to give the best quality health care to our members, and we should not settle for less. And these are the people that really form the backbone of our clinics, of our hospitals, both primary, tertiary, secondary, nationwide.
Ang galing naman ng Intellicare, ano ha? Ang gusto sabihin yung hindi summa cum laude sa medicine, hindi sila pwedeng ma-accredit dyan sa Intellicare na yan. Ang gusto po sabihin nun, lahat ng mga specialist nila ay dekalidad. Board certified po yan. Tandaan po, board certified. Napaka-importante po nun Not any Dick and Harry are accredited sa Intellicare. Well, napakaganda naman noon, ano? Kanya naman pala kayo. Well, hindi ewan ko kung hindi can I mention this that I heard that you're in the first three among the top HMOs dito sa Pilipinas?
We have always tried to be low profile because, as you say, in our world, as in any siguro industry, there's always a higher level of competition pag nakilala ka o pag nakikita kang sumisikat ka. So what we would like to do is low profile, we'll just grow, and we don't really advertise because I think the most important advertisement really at the end of the day is when your members speak well of you.
Yes.
And that is your greatest advertisement.
Well, narinig po natin ng presidente ng Intellicare. Sabi nga niya, HMOs, ayan, yung mga accredited doctors nila, ganon. And Intellicare is one of the top HMOs in the Philippines. To watch up, Doc. Well, on the topic of Intellicare, the HMOs. Now, Mr. President, Mario, you mentioned that your company started in 1996, and it's only
13th year.
13th year na ngayon.
Oh.
And what was your secret? How come Intellicare is like a shooting star among the HMOs?
What is important kasi sa amin, since the very beginning, when we formed the company, it was very important for us that the people and the culture we create in the company is for other people. Yung pagmalasakit na sinasabi natin. So, ang kinukuha namin ng mga tao na re-recruit namin, ang nagjo-join sa amin, may pangmalasakit sa kapwa. So, ang binabantayan namin palagi, paano namin matulungan yung mga kababayan natin na kailangan pumasok sa ospital o kailangan magpa-diagnose, kung paano natin matulungan na it will be made easier for them to avail of it as they need it and where they need it. We wanted to give that to them.